Hi, my name is Jillian Honeycutt. I am currently enrolled in Winston-Salem State University in the Clinical Laboratory Science program. I am set to graduate May of 2024. I'm here today to present to you my research on procalcitonin as an effective biomarker in detecting sepsis. This study will compare procalcitonin compared to already established biomarkers when assessing patients who present to the emergency department with sepsis symptoms. Why sepsis? Sepsis is a huge fatal challenge worldwide. It continues to be on the rise with close to 50 million cases a year and 11 million of those resulting in death. It's important to develop specific protocols to diagnose patients with sepsis earlier on. Earlier identification in the initial hours after sepsis develops has been proven to improve outcomes for patients. Septic shock is also a subset of sepsis, if the abnormalities are profound enough, it can substantially increase the patient's mortality. What is the procalcitonin test and what does it do? Procalcitonin is a prohormone of calcitonin. It contains 116 amino acids. These tests are used to tell the physician if the infection is caused by a virus or a bacteria and where the patient's infection is. This can help patients the physician because if it is a viral bacteria, they can, or if it's a virus, they can go ahead and administer antivirals. If it's a bacteria, they can go ahead and administer antibiotics. Low levels of procalcitonin are normal. In healthy individuals, it ranges about typically less than 0.1 nanograms per milliliter. Procalcitonin is generally used and ordered for very sick people who present to the ER or people who have already been admitted to the hospital and are very sick. People presenting with the following symptoms can be candidates for the test: shortness of breath, pain, confusion, altered mental status, clammy or sweaty skin, fever and chills, rapid heartbeat, or low blood pressure. Procalcitonin levels rise in your circulation in response to any kind of endotoxins or inflammatory cytokines in individuals with systematic inflammation or any kind of bacterial infection. Procalcitonin levels show an increase within 2 to 6 hours, but they peak within 6 to 12 hours of the infection. Procalcitonin, in conjunction with other sepsis biomarkers such as MDW, MCV, white blood cell count, interleukin-1, C-reactive protein, can all help in detecting sepsis earlier in patients. How will it be performed and what will be involved? In this study, we will take a duration of 6 months. It could be longer, could be shorter, depending on how long it takes us to get the required amount of patients. If we get them before the 6-month period, great. If we get them beyond the 6-month period, that's fine as well. We want to include 350 patients, both male and female. We want to include patients that are presenting to the ER with symptoms of sepsis or patients who have been diagnosed with sepsis or septic shock. The use of procalcitonin in collaboration with the CRP, white blood cell count, and MCV results in each patient of the study. The criteria to be included in this study will be patients presenting to the ED between the ages of 20 and 79, both male and female. They must sign an informed consent to be included in this study. And any patient presenting with symptoms of sepsis to the ER or currently has a diagnosis of sepsis or septic shock. Any rejection criteria includes any patient less than 20 years old or any patient greater than 79 years of age. A patient who has recently had surgery or trauma within the last 72 hours will be excluded. Patients with acute pancreatitis, burns, or chronic kidney disease. Patients with no informed consent signed. Samples other than lithium heparin plasma and samples below the required testing volume will be rejected as well. Testing. Testing will be collected in green lithium heparin tubes using standard venipuncture techniques. The minimum volume required for testing is 0.5 milliliters. The testing will be performed on Beckman culture AU5800s, and the turnaround time for this test is about 1 hour. Results will be collected daily by the manager and entered on an Excel spreadsheet. Procalcitonin results that are less than 0.05 nanograms per milliliter are reported as less than 0.05 nanograms per milliliter because they are less than the linearity on the machine. The data entered on the spreadsheet will include the patient's age, sex, initial procalcitonin value, any underlying condition or disease that will affect this patient's procalcitonin levels, the outcome, and the length of stay. Outcomes determined based on predefined possibilities include 1, if the patient improves and is discharged from the emergency room, 2, if the patient is admitted and dies on the floor, 3, the patient is admitted, transferred to the ICU, and then dies, or 4, the patient is admitted or transferred to the ICU, makes an improvement, and then is discharged. The Spearman correlation coefficients will be configured for procalcitonin and the length of stay, as well as procalcitonin and the patient's age. The Kruskal-Wallis test analyzes the data between procalcitonin and the outcomes, and the Wilcoxon rank sum test will compare the association between procalcitonin and sepsis versus sepsis shock. We want to use all of these different analyzing tools to see how procalcitonin affects each one of these variables. How procalcitonin affects the length of stay or the patient's age. Like, does the patient's age affect the procalcitonin? A patient being 79, is their procalcitonin different than a patient who's 25 and has sepsis or septic shock? So we kind of want to use these different tools to analyze that data. In conclusion, we will learn that biomarkers definitely have their limits in detecting sepsis early. Each biomarker is different. Each biomarker detects different things, so obviously there is a limit in detecting the sepsis earlier as indicated. This study will show that although there are other biomarkers that increase in sepsis, this biomarker, procalcitonin in particular, will help determine a patient's sepsis risk earlier on. So the earlier that we are able to determine the patient's sepsis outcome or sepsis risk, the earlier we can treat this patient and decrease the patient's likelihood of being admitted inpatient, having a mortality risk, being admitted to the ICU and possibly being put on a ventilator and not getting better, waiting on blood cultures to come back to see what the organism is. Like, we can treat early based on procalcitonin results, based on whether it's viral or bacterial. This is a huge thing. Obviously, the earlier we detect it, the more likely we are to treat it and increase the patient's status of getting well, which is great. Procalcitonin used as a biomarker does need to be studied further. It doesn't have a lot of research right now. There is very limited research on it, so it does need to be studied further along different groups, not just people in the ICU, not just people inpatient, not just ED, but really amongst all kinds of patients. You know, we need to study procalcitonin in well patients versus procalcitonin in semi-sick patients versus sepsis versus septic shock to really see what the difference is in how procalcitonin relates. What kind of difference can this marker make? That is the main goal. This data from this study can be used to evaluate and treat patients with suspected sepsis. So we don't want to really evaluate and treat any patient that has been diagnosed because we don't know if this data will work. We don't know for sure if, this study will be funded or will be accepted. So our goal is to have procalcitonin as a biomarker. It would be great to help, early indicate things. So that would be awesome. That is the end of my presentation. I hope that you all really enjoyed listening. I thank you all for taking the time to listen to my presentation and my research that has been done on this. Like I said, there's very limited research on this, so really digging to find resources was really hard because some of the resources, it was either repeated or it was the same. So, I just kind of look forward to seeing how it works out. Thank you so much.